Do you know the first silent signs of diabetes that most people ignore?
Diabetes is a chronic medical condition where the body either does not produce enough insulin or cannot use it effectively. Insulin is a hormone made by the pancreas that allows sugar glucose from food to enter cells to produce energy. Without insulin, sugar builds up in the blood, causing hyperglycemia and over time damaging organs. There are two main types. 1. Type 1 diabetes, an autoimmune condition where the body's immune system attacks insulin-producing cells in the pancreas. It usually develops in children, teens, or young adults. About 5 to 10% of all people with diabetes have type 1. Globally, the incidence is increasing slightly, with around 1.1 million children and adolescents affected worldwide. WHO, 2021. 2. Type 2 diabetes, the most common form, accounting for 90 to 95% of all cases. It occurs when the body becomes resistant to insulin or the pancreas cannot produce enough insulin. Type 2 diabetes typically develops in adults over 40, but due to rising obesity rates, it is increasingly seen in younger people, even teenagers. Globally, over 422 million adults have diabetes. WHO, 2021. Prevalence is highest in countries with high obesity and sedentary lifestyles. For example, the United States has over 34 million people with diabetes. CDC, 2023, India over 77 million, China 116 million, and Mexico around 12 million. Risk factors for type 2 diabetes include overweight or obesity, physical inactivity, poor diet high in sugar and processed foods, family history, high blood pressure, aging, and certain ethnic backgrounds. Type 1 diabetes risk factors are less understood, but genetics and possibly viral infections play a role. Early symptoms of diabetes are often subtle and easy to miss. Increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, slow healing wounds, and numbness or tingling in hands and feet. Studies show that 1 in 4 adults with diabetes is unaware they have it, highlighting the importance of early detection. IDF Diabetes Atlas, 2021. Understanding diabetes at this level is essential because untreated diabetes can lead to severe complications, cardiovascular disease, kidney failure, neuropathy, and vision loss. Awareness, regular checkups, and knowledge of risk factors can prevent or delay these outcomes.
Can diabetes really be prevented or even reversed? Managing and preventing diabetes is possible with the right lifestyle choices, regular checkups, and medical support. For type 1 diabetes, there is currently no known cure. The main treatment is insulin therapy, which must be taken daily. Insulin can be delivered through injections or insulin pumps. Research is ongoing into pancreas transplants, stem cell therapy, and artificial pancreas devices, but these are not widely available yet. For type 2 diabetes, many cases can be managed, and even prevented, through lifestyle changes. Doctors recommend healthy diet, eating more whole grains, vegetables, fruits, lean proteins, and reducing sugary drinks and processed foods. Regular exercise, at least 150 minutes of moderate activity per week, like walking, cycling, or swimming, helps the body use insulin more effectively. Weight management, losing even 5 to 7% of body weight can significantly reduce the risk of developing diabetes. Medication, if lifestyle changes are not enough, doctors may prescribe oral medicines like metformin, which lowers blood sugar, or other newer drugs that improve insulin sensitivity. Preventing diabetes is especially important for those at risk. Studies show that people with prediabetes can lower their risk by more than 50% through diet and exercise alone. Quitting smoking and reducing alcohol intake are also important. Monitoring blood sugar regularly, checking blood pressure, and visiting a doctor at least once a year can help detect problems early. Vaccinations against flu and pneumonia are recommended for diabetics, since infections can be more dangerous for them. The future of diabetes treatment is also promising. Researchers are working on gene therapy, improved medications, and non-invasive glucose monitoring devices. These innovations aim to make living with diabetes easier and safer. Remember, diabetes is not the end of life. Millions of people live long and healthy lives by following medical advice, staying active, and making smart choices every day. Awareness and prevention are the most powerful tools against this global epidemic.